demonstrate now on how to perform wound care. Number 1. Identify patient using at least 2 identifiers. This is to prevent performing a medical procedure on a wrong patient.
Good morning, ma'am. Unsa ganing mong pangalan, ma'am?
Charmalita,
Kano sa ganing mong birthday?
July 16, 2005.
Number 2. Reviews order irrigation and the type of the solution to be used. This is to confirm order procedure as well as have the opportunity to raise concern to the physician.
We are here the doctor's order to do wound care using normal saline solution.
Number 3. Assesses the patient level of comfort. Offer analgesic at least 30 minutes before removal. The process of performing wound care may involve manipulation to the wound itself, thus irritating the nerve endings in the epidermis. Analgesia may then provide much needed comfort for patients with low pain thresholds.
Ma'am, kumusta mo sa madili ba gamot o sakit? So, ma'am, karon kay ato ang nang reviewhan imuhang samad, maghatag lang ko ninyo ang tambal para dili kaayo sakit pa ato ang reviewhan na.
Number 4. Reviews the medical record for symptoms related to the patient's wounds. This provides more data to the performing nurse, thus enabling her to tailor her approach more precisely, fitting for the patient's unique health demands.
Reviewing record of the patient symptoms, patient wound, we have here patient experiencing pain with a pain scale of 5/10 with a characteristics knowing pain.
Number 5. Assesses the patient for history of allergies to antiseptics, medication, tapes, or dressing materials. This is to promote comfort and prevent any undue anaphylactic reaction.
Ma'am, mangutan ko sa inyo habang naba may mga allergy sa like latex, mga gloves, gauze pad, kaya ginagawa sa dressing, mga tape.
Identifies the expected outcomes. This is to establish a standard and rendering wound care. Administer analgesic as ordered 30 to 45 minutes before the procedure is initiated. This is to promote comfort and reduce anxiety associated with performing procedure.
Ma'am, mag-inom tag tambal na ha para pag hinuan na to imuhang sama, dili kaayo sakit na ha.
Educate the patient and family about the procedure. This is to promote transparency, build rapport, and enables the significant other to learn on how to perform the procedure themselves.
So karon ma'am, ang ato ang buhaton kay ato ang limpyuhan imong samad, tapos kwaon nato na ang imong daan na dressings, tapos i-irrigate nato. So it means ang irrigation kay bubuan nato siya solution para makuha itong mga nana o mga hugaw. Nya pagkahuman og irrigation, ato ang i-dry nato imong samad, tapos butna nato bag-o na dressing para nindot ang healing sa imong samad.
Gathers appropriate supplies. This is to promote organization and proper body mechanics, thus conserving energy.
So we should always gather appropriate supplies like normal saline, kidney basin, or any kind of Tupperware, syringe with undue catheter, and cotton buds for getting the specimen, waterproof pad, biohazard bag, and gauze pad or any material like bond paper if you don't have gauze pad, and then bandage tape, or if you don't have a bandage tape you can use any tape. Then PPE consisting of gloves, mask, face shield, gown or apron. So this is those materials we needed in our procedure.
Provides privacy, performs hand hygiene, and position the patient appropriately. This is to prevent the wound from being overexposed and to safeguard the client's self-esteem, as well as to prevent infection.
So, siraan na to ang portahan mamaya. And then, maghugas tao ka.
Perform hand hygiene. This is to prevent the spread of microorganisms. Form scalp waterproof biohazard bag and places near the bed. This is to promote organizational and proper body mechanics. Applies PPE, place sterile precaution if needed, then discards all dressings and gloves and perform hand hygiene. This is to prevent contributing further the likelihood of infection, to protect the healthcare professional from being infected.
So, this is the PPE. So, for now, I will be removing my face shield and mask. So, you can see I am explaining the other procedure.
Applies clean gloves and perform wound assessment. This is to prevent cross-contamination between the patient and healthcare provider, as well as enable the nurse to plan how or she is going to move forward with the procedure.
So, we're done in gloves. So, sakit na. And now we are now assessing the signs of coloration, odor, consistency, and amount of drainage.
Purify. Expose the area near the wound only. This is to have a facilitate asepsis and prevents the surrounding skin areas from being contaminated.
Remove the old dressing by peeling the adhesive into the skin, then gently pull it. And then assess the drainage. There is a lightly blood on the dressing, and then fold the dressing, then discard properly, and also discard the gloves.
Number 6. Irrigates wound with wide opening. First, fill syringe of irrigation solution.
Ma'am, ato ni ibutang di ari na. Tapos, mabutang ka ito pad para isalo na inya pag natalaguan ka o tubig. Inya, mabutang po ta kidney basin para pag mag-irrigate sa tamang dire lang
Attaches 19 gauge angle catheter. This is to enable the healthcare professionals to provide the proper amount of pressure during irrigation.
And then irrigate.
And third, hold syringe tip above upper end of wound and over area of being cleansed. This facilitates cleansing of the wound, covering the highest amount of surface area. This also promotes sterile technique. And then fourth, flushes the wound using continuous pressure until solution draining is clear. This ensures that debris pass and exudates the clog on the surface of the wound is removed. Number 7. Irrigates deep wound with small opening. First, attaches soft catheter to the filled syringe. This is to eliminate the risk of needle stick injury and to ensure that the irrigating solution reaches the deepest corners of the wound, as well as to apply the appropriate amount of pressure to remove unwanted material. And then second, insert tip of the catheter into the opening. This is to attach the soft catheter to the syringe. And then the fifth, removes and refills syringe, reconnects to the catheter, repeats until the solution draining is clear. This is to ensure that the unwanted material from the wound has been cleaned up. And then number 8, applies clean gloves, cleanses the wound with handheld shower. So first, perform hand hygiene, apply clean gloves, adjust spray with patient seated, ensure water was warm. This is to prevent infection, direct the flow of the water, promote comfort and vasodilation.
Ma'am, na ko ma'am ha kung init ka ayo. Init ma'am, o tama lang.
Tama lang.
Second, shower for 5 to 10 minutes. This is to facilitate adequate cleansing and prevent over-cleansing. Nine, abstain culture after cleansing with non-bacteriostatic saline when indicated. Applying bacteriostatic agent obscure the presence of certain pathogen, rendering the diagnostic test ineffective.
Magkuha ko samples specimen sa magna ha. Para tapos para i-laboratory na para kapalaga.
Number 10, dries wound edges with gauze or sterile or dries patient. This is to reduce moisture and prevent further bacterial growth. 7. Applies appropriate dressing, labels with time, date, and student initials. This is to provide proper documentation and accountability.
Napakihawin ko ito. Time and then dressing.
Number 12. Remove mask, goggles, and gowns. This is to dispose contaminated PPEs and prevent infection spread. Number 13. Dispose equipment and solid supplies. Removes gloves and perform hand hygiene. This is to prevent the spread of infectious material. Number 1. Have the patient rate level of comfort. This is to determine the level of comfort that the patient had intra and post procedures, to promote patient satisfaction and identify areas of improvement.
Kumusta naman man? Unsa man imong na-feel sa mga samad? Wala na nagbanit niya? Wala naman.
Number 2. Monitor the type of tissue in wound bed. This is to determine whether or not the wound prognosis is good.
Sa ato ang pag-review ganin ma'am, so base, nakita nato na nana siya epithelial cells. So it means hapit na siya mag-heal ang inyong wound. So pila na lang kasi mana ma-heal na na inyong cell.
Number 3. Inspect dressing once every shift or as ordered. This is to obtain up-to-date assessment data.
So ma'am, pagkahuman ani, i-check na to ni paghuman ako o paghapit na ako ang shift or kailangan ba na siya ilisan o dressing kung napuno na siya o dugo. Or depende sa doktor kung iyang ipa-check every 4 hours. So mag-check ta every 4 hours.
4. Evaluates per-wound skin integrity. This is to determine whether or not wound healing is progressive smoothly.
So ma'am, tanawa na to ang inyong kilid sa imong dressing kung nagpula-pula ba siya. So wala man nagpula-pula, so okay man siya. Kaya kasagaran mong good, nagapula-pula ang kilid dito nga sige kuha sa dressing.
Number 5. Observes for presence of retained irritant. This is to ensure that the wound is adequately cleansed.
So ma'am, tanawa na to ma'am kung naabay irritants na napilin, so wala man kay ato namang nakuha taan.
Number 1. Records procedure and all findings in the patient's chart. This is to facilitate accurate documentation.
So, records the procedure. So, the wound care done at 8 a.m. Then findings, we have a tickle shows epithelial tissue, wound healing present. And then, no complaints of pain.
And second, reports to the healthcare provider. Any evidence of fresh bleeding, sharp increase in pain, retention of irrigant, or signs of shock immediately. This is to provide the appropriate medical intervention as properly as possible and to promote a desirable health outcome.
So, ma'am, mga tanong ko, ma'am, nagasakit ba siya or nagamot mo? So, kung nagasakit siya, ma'am, iigna ko, ma'am, kay ato ang i-refer sa akong doktor o ato ang para na ay proper check-up o proper care.